I founded Healthy-TXT to combat one of the biggest problems that I see in clinical medicine, and that is that doctor-patient communication is broken. One of the ways that Healthy-TXT works is with what we call our Circles platform, and I'd like to show that to you now. Let's say this patient is John Doe. Simply type their name up top. Their cell phone number, we simply enter that. The trigger date. So in this example, we're going to say that John Doe is getting discharged from the hospital with congestive heart failure today, February 23rd, 2015. We're going to select a diagnosis. You can see that this hospital is using multiple different programs: chemotherapy in Spanish, congestive heart failure in Polish, and congestive heart failure in Spanish. So let's choose congestive heart failure, and we could send additional notes in this field. So, for example, don't forget to get your labs drawn on Wednesday. We can then enter their family and friends, what we call the circle of care. So now anybody else that we want to receive the same messaging, we simply enter their phone numbers here. We can enter future appointment dates. So let's say that our patient John Doe has an appointment on Friday at 1:15 p.m. with Dr. Smith. The day before that appointment and on the day of that appointment, the entire circle of care is going to receive messaging reminding them of that appointment. So this is an example of the type of messages that you might receive using the Healthy-TXT program. We can see at the top here, weight gain can be a sign of problems. Weigh yourself daily, and if more than 2 pounds weight gain, tell your doctor or nurse. So that's a message that would go out to a patient being discharged with congestive heart failure, as well as their whole circle of care. And with a message like that, that will drive action. Out of the 4 or 5 people that are receiving that message, somebody will make sure that that is getting done. These messages also can have links to other web pages. So we may create a web page with that institution, with the hospital, that highlights activities at the hospital and also leads back to other information that is pertinent to that patient so that they can review other information as well. So as you can see, the Healthy-TXT system allows you to better communicate with patients, which improves their satisfaction and improves compliance. And by improving compliance, improves health outcomes. It also allows you to practice more efficiently, reduces phone calls, better educates patients, your staff is happier, practicing more efficiently in this environment when we need to, as more patients are actually coming into the system, but we have less and less time to see them.